am more than breast cancer.
I am more than gastric cancer.
I am more than Hodgkin's lymphoma stage 3.
I am more than Lynch syndrome.
I am more than metastatic male breast cancer.
I'm more than PMDD.
I am more than diabetes.
I am more than lupus.
I am more than FAP.
Welcome to More Than a Diagnosis. I'm Den.
And I'm Jess. This podcast is about so much more than cancer, chronic illness, or the labels we've been given. It's about reclaiming our lives, finding community, and thriving in ways we never thought possible.
Whether you're a patient, a caregiver, or just someone curious about what it means to live beyond a diagnosis, we're so glad you're here.
So we've known for a while that we wanted to record this episode, and I think part of why it's taken us a bit is because this isn't just a topic, this is a really personal subject.
Very personal. It feels so different talking about this out loud, especially in this space. I've shared pieces of it over time, but not like this, and not really centered on what it felt like.
Yeah, and I think that's what matters here. Not the medical details of your story or the timeline, but really what shifted from when you went from being the nurse, the one who knows the system, to suddenly being the one on the other side of it.
Yeah, because, being a nurse is not just a job. It becomes a part of who you are, how you see yourself, how you move through the world, how you show up for people,
Yeah, absolutely. And then illness comes in and kind of quietly takes that certainty away. You're still you, and you still have all that knowledge. And like we talked about on last week's episode, you'll always be a nurse, but your body now is asking for something completely different.
A lot has changed, and there's loss in that, as well as reckoning. Being on the other side of the bed changed everything, how I understood care, control, and lots of vulnerability in ways I never saw coming.
Yeah, absolutely. And as your friend, I've watched you carry all of this from being on disability to going back and being a nurse actively. And it's been amazing to watch the transformation and just kind of see how this has all taken shape. And I think it's a great thing for us to chat about, because I feel like every nurse that I've run into since my diagnosis always says that they are the worst patients. Can you confirm this for us?
I can neither confirm nor deny.
Are nurses notoriously bad patients?
100%. I can only speak for myself right now. And
of course.
I am a terrible patient.
Yeah.
It's hard.
Yeah.
Being a nurse becomes a part of your identity.
Yeah.
And it's oftentimes really hard to separate the two. But when you get sick, you're left with no choice.
Yeah.
But to swap hats. Because in my case, it was just so much that the patient hat came on fairly quickly. And the nurse hat was still there, just had to take a back seat.
Sure.
But boy, I was not ready.
So before the trauma, before the major diagnosis, before all of the surgeries, before you ever got sick, what was it like for you being a nurse?
It was, let's see. It was nice. I didn't have to worry about physical issues. I was pretty healthy, I'd say.
Yeah.
The only thing that I really struggled with were migraines. But other than that, my body physically was able to perform as a nurse. There were no limitations whatsoever.
Yeah.
I, was able to carry the weight, lift, pull without, frowning or without ouch, or feeling that little muscle, tighten or whatnot.
Yeah.
So it was easier than
Physically,
it
it
is
was
now.
easier.
Physically easier.
Yeah.
Mentally also, only because, sickness, your mental health takes a hit. And
Yeah.
so it does look different now. But I do think that I did have empathy back then, just not as much as I do now.
Yeah, I can imagine.
I don't think I really understood what our patients would go through.
Yeah.
I didn't understand. Yeah, I'd had like an IV in before, but surgery, okay, once when I was 15.
Yeah.
But, you're pretty young at 15.
Yeah.
And these patients had, multiple surgeries, had gone through so much and lots of chronic illness. And I thought I understood. I really did.
Yeah.
Boy, I really didn't.
Do you feel like you had sort of a sense of, I don't know, you were in your early 30s when all of this started, right? Before your diagnosis. So, being a nurse in your 20s and your early 30s, do you feel like you had sort of a sense of invincibility?
Oh, absolutely.
When
you're young,
Yeah.
you don't even think you need health insurance.
Yeah.
And I'm like, do I need, that 2-week waiting period? I'm pretty healthy. Let's extend it.
Yeah.
I'll be fine.
Yeah.
It'll be fine. And you don't think about ever hitting that wall where you're diagnosed with something. It never crossed my mind.
Yeah.
Never.
I mean, it's like, it's interesting because it's something that you see every day. You see all the time. I mean, you worked with cancer patients at one point, and so you see it, you knew it was a possibility, but more it's kind of this idea that it's your patients and not you.
Exactly.
And it's not that you don't know that it could be you, but I think, I don't know, we just have a level of invincibility that comes with age and experience.
And I sure did.
Yeah.
I was there to care for my patients because I was good.
Yeah.
So I'm here to take care of you. I don't need to, go pee because I'm here to take care of you.
Yeah.
Everything that I needed, all of my needs would get pushed to the side because I was there to care for my patient.
Yeah.
And only my patient.
Yeah.
And that was okay back then.
Yeah. But not now.
Nope. Nope. And then also I feel like now I have a sense of wanting to include the patient in their care more than I did before.
Yeah.
It's really easy as a nurse to get very task oriented, and sometimes, in the midst of the craziness, it's easy to forget that you're treating a person.
A person and not just a patient.
It's just part of it. Like, you can easily lose sight of that.
I can see that. I can see that from watching the nurses at the infusion center and how they're bouncing around from person to person and they're so busy. I can see how you could just get into the zone of like, okay, I got to go start this IV. Okay, I got to go take this one out. I got to go flush this. I got to go get this person medicine. And you just kind of like moving from thing to thing.
Yeah, exactly. And, not that I didn't do it back then, but I feel now it's different. I spot it faster. I walk into the room and instead of me automatically jumping to do my job, it's, are you comfortable in that position? Are you warm enough? It's freezing here.
Yeah. Yeah.
It's a person that I'm treating, not a cataract surgery.
Yeah. Yeah, for sure. Do you feel like there was a particular moment after shit kind of hit the fan and things kind of went a little awry on your plan of life when you actually sat down and said, oh, I guess I'm the patient now?
Yeah. It was the moment that scan result came back with the tumor. I was like, that's my scan. That's my abdomen. That was eye-opening. It, in an instant.
Yeah.
A switch flipped, and boy, was that a pretty rude awakening. Because you're used to, when patients are in for surgery, you can see their scans, you can see their results and whatnot. But to read and see my results,
Yeah.
I didn't know what to do.
Yeah.
I
Seeing
didn't
your
know how
name
to
there,
react.
seeing the
Yep.
tumor there, and
Yep.
being like, wait, that's
Yes.
me?
Yes. And then knowing what you're reading, because
Yeah.
even though I'm not, it's not within my scope to interpret results, scan results, imaging results. But I knew enough.
Yeah.
And it's cool, but also not cool.
Yeah. Well, I think that that's something that maybe folks don't always take into account when you think of someone who is a health professional, whether they're a nurse or a doctor or an MA, whatever it is, and they're faced with major diagnoses. There's this reality where sometimes the knowledge helps, but sometimes it can also hurt.
It's a double-edged sword.
Yeah, I can imagine.
It's a trip, because also once I realized that's my abdominal area, there's this sense of grief, loss, because I knew that I would have to step back from being a nurse because I couldn't do both.
Yeah.
And that comes with a lot of grief, it's raw, it's emotional, there's so
like
much
you're
vulnerability.
It's like you're losing a part of yourself, essentially.
Yes, it's literally part of my identity is just slipping right through my fingers. And
Yeah.
no matter how hard you try to collect that sand, it's just slipping right through.
Yeah. Yeah.
And it's hard to grasp that concept. It's hard to radically accept that.
Yeah. Well, and I'm sure that there's another layer to that, because while anyone who goes through a major medical diagnosis, anybody who's living with a chronic illness and at the doctor all the time, or facing a cancer diagnosis or whatever it is, we also all have some sort of grief and loss that comes with that, especially if it affects our ability to work, it affects our careers. But with nurses, you are in a hospital, in a doctor's office setting a lot. Yeah. And it must feel like a sting because you see everybody else doing your job that you can no longer do, or you can't do in that moment and for whatever amount of time that is. And so it's almost like it's being thrown in your face.
Oh, big time. And in ways that you wouldn't necessarily imagine. Like, for example, I'm going to just take a little detour because this story just popped into my head.
Yeah.
And so this one time I was in the hospital. It was during one of my complications. My body was actively rejecting the mesh that they had implanted, and they couldn't get an IV in. Usually I'm not a difficult stick, but because of everything that had transpired,
sure,
there had been changes to my veins for whatever reason, and they were no longer available and ready to get stuck.
Yeah, yeah.
They were trying to make, the nurses' lives a little impossible. But I got stuck a total of over 10 times.
No. I mean, I'm certain that after the second time, you wanted to grab the needle out of their hand and be like, can I just do it myself?
Mm-hmm. Yep. I sure did. And you know what? It was this.
No.
It was really hard because as the patient, I'm like, ow, this is a lot. Like 10 times. Okay. Like, no, this is not okay. It was 5 different nurses.
Oh my goodness.
2 pokes each.
Oh.
And then as a nurse, I felt for them.
Sure.
Because I knew they weren't doing it intentionally.
Of course.
They were trying their hardest.
Of course.
And I had appreciation for them, but also this hurts. And
yes.
Can we please just get an IV in? Because I feel
crappy.
Oh
my goodness. Like that is such a mix of emotions all at one time.
And wait. So I don't like telling nurses that I'm a nurse. because things change. Like, nurses don't like to let other nurses know they're a nurse. It's just, it's this thing, okay? Ask any nurse.
It's funny because it's the total opposite. When I go in, I tell everybody my best friend's a nurse.
I know.
I wear that shit as a badge of honor. I'm like,
you do.
nope, my best friend's a nurse. I'm like, I know about this.
She kind of, diagnosed me already. I think you need to run some more tests. She said.
So this is like a pretty standard thing across the board that nurses don't like other nurses to know when they're the patient that they're 100%. A nurse.
Things change. Sometimes not always for the better.
For the better. Yeah, not always for the better.
Always for the better. Depends.
Well, because I'm sure there's a sense of pressure, right?
Yeah.
Like if those nurses who kept sticking you over and over again knew that you were a nurse.
Wait, but they did.
Oh no!
And that added a whole lot. I didn't even get to that part yet. Wait.
Oh no!
Wait. After the second nurse, they were all like, wow, I'm pretty sure you could start your own IV, huh? You do this at work all the time, huh? Because currently I was, placing quite a few IVs and, I'm pretty good at it.
Yeah.
And so, it was awkward because they felt a certain way. And, as a nurse, you want to do your best job. And then when it's a nurse, at least for me,
like you want to do even better.
You want to do even better because that's your colleague.
Yes.
You're equals. And so you want to do your damnedest.
Yes, you want to. It's almost like you want to show off. Like, let me flex my skin.
Right. Exactly. Right. And so it was just. And so then I felt like I had to not console them, but understand them and be empathetic towards them.
Mm-hmm.
But also, ow.
Yeah.
And so
I'm getting poked here 10 times, but now I have to have empathy for you because I would want somebody to have empathy for me as a nurse.
Yes, exactly.
Oh, that's so heavy and complicated.
It is. And whether you like it or not, it interferes with healing and processing.
100%.
And it complicates things quite a bit, I'd say.
100%. So, okay, besides the, IV sticks and, not wanting people to know that you're a nurse when you're in that setting, how do you feel like the medical knowledge shows up for you as a patient? Maybe both in good ways and not so good ways.
Yes. So, like I said, it's a double-edged sword. And when I was having my C-section, I had to get an epidural.
Mm-hmm.
And, epidurals, they go by levels, and it can, if it's injected in a certain way, it can go up towards your, thoracic, cervical. And so when the medication starts running that way, then it can feel like you're getting numbed up. And so my chest was starting to kind of numb up and not be able to really stretch out with every breath. So I felt like I couldn't breathe.
Mm-hmm.
And it was getting heavier. And I said, hey guys, I think that the epidural, the medication's going way too far up. Like, I'm starting to have difficulty breathing. And in my head, I'm like, patients probably wouldn't
know that.
It, but I'm like, okay, this is what I see in books and it's happening to me. And so I started freaking out because then it was really hard to breathe and I felt like it was getting more intense. Not sure if it was really the medication or the medication and me freaking out that was causing a little bit more
anxiety.
Panic. And so, they tried to, calm me down. And then Ivan, my husband, was like, she's a nurse. I think she just knows too much sometimes.
You're like, you weren't supposed to tell them.
I'm like, why are you telling them I'm a nurse? And this is in the middle of my C-section. Okay. And so, the anesthesiologist was like, oh, a colleague. And, it was It was funny. It ended
That
up
is funny.
turning into a joke, and he's like, okay, don't worry, I got you. And, was able to fix things. Adjust it all. And
so you were right.
so, yes, I was not completely wrong.
Yeah.
So that's one example. Another, I feel, is it's tricky because when you're a nurse, you know enough to be able to do certain things for yourself.
Mm-hmm.
Like, I went home with a drain, and a drain that potentially someone who went home with would need home health.
Mm-hmm. Mm-hmm.
Now, because I was a nurse, I didn't get that home health because it was an assumption that I have cared for these kind of drains on other patients, so therefore I can care for my own, which is not necessarily fair.
No.
Because I had a lot going on.
Yeah.
And it's stress, it's just overwhelming, but nurses, I feel, tend to, I don't know, still hold that nurse hat. Even though you're a patient, they still hold on to that nurse hat for you.
Yeah. Yeah.
And to a certain degree will expect you to know certain things. And when your brain's foggy and your mental health has taken a hit, I wasn't as sharp of a nurse as I used to be.
Of course not. I mean, you're a patient. You should be worrying about the things that you need to worry about as a patient, not having to put your nurse hat on and worry that you're going to break something, do something wrong, make something come off that shouldn't, whatever.
Yeah. And, looking back, there were times that as a patient, I was so self-critical because that nurse hat wouldn't want to fly off my hat. And so, fly off my head, I mean.
Yeah.
And so, it was, wow, how come I didn't see that coming? If it would have been a patient, I'm sure I would have seen that.
Yeah.
Hindsight's always 20/20.
Yeah. Well, it's not fair to expect those things out of you as a patient, that you're going to be wearing both hats at the same time,
At the time.
That's so much pressure.
But at the time, that's what I expected of myself. And so I think part of it was me not wanting to let go of that part of my identity.
Sure.
And another part was me trying to take control over my situation, because when you get diagnosed with something so major, there's this loss. There's this, it's like they're taking autonomy away.
Yeah.
They're, having to make decisions, and sometimes you're not necessarily a part of those big decisions, even though you should be. And there's so many changes that you're not really able to adjust because you're stuck between the two roles.
It's so much.
Really messes with your mind.
Well, and it's not only your own internal pressures that you're putting on yourself, but like you said, if you're in these situations where they know that you're a nurse and they're sending you home to do things that another patient would have home health for, then it's external pressure as well. And then if they're putting that external pressure on you, it almost feels like you then have to double that pressure down on yourself.
And then I have to live up to that pressure. I need to perform, because if I don't care properly for that drain, then there will be complications that I'm well aware of.
Yeah.
So knowing I'm a nurse, I know how to do the job, and I know that I needed to be extra careful doing the job on myself.
Yeah. Yeah.
And
do you feel like, so I know that, because of our friendship, that I have learned how to better advocate for myself and ask better questions and just kind of know how to approach appointments from a different vantage point because of you and because of what you've taught me. So do you feel like that has translated for yourself as a patient, that you're better able to advocate for yourself and stick up for yourself and ask for things, request tests or blood work or whatever because of the knowledge that you have?
Yes. And that's the part of being a nurse that's cool.
Yeah.
And comes in handy because, I can go and talk to my doctor, even now still doctors, and say, hey, I was thinking about this, this, and this. Can I run this by you? I think maybe I'd like to extend my course of antibiotics because I'm feeling this, 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 and this.
Yeah.
And so it's great because most of the time that healthcare professional will take my consideration into account because I am a nurse and that's my profession.
Yes.
And so when you find a healthcare professional, healthcare provider that sees you as a patient but also respects your knowledge, it's really nice.
It's a sense of privilege, really, because as someone who is not a healthcare professional, if I were to go in, depending on the doctor, they might see that as me challenging them or thinking that I know more than them, even though it's me knowing my body or having someone in my life who I'm close to who knows things. And so I feel like for me, I have to approach those kinds of situations maybe a little bit differently than someone like you who is a nurse, because you will be listened to and respected from a different vantage point because of your knowledge and your expertise as a nurse.
Yeah. And not all healthcare professionals are receptive. I'll throw that out there.
Oh, yeah.
Some, even though I am a nurse, sometimes it comes down to gender, age.
Of course. Ego.
A lot of cultural preferences and whatnot. So
sure, I can imagine.
Do also play a role into how information is received.
Yeah.
But it is really nice when you feel like you can be part of your team and collaborate in your care.
I mean, honestly, that's how it should be.
Yeah.
Right? Like, they should be collaborating with the patient for their care because we live in our bodies and we know what's going on in our bodies. So you had mentioned, how things have changed now that you're back to nursing again after being on disability for so long, and that your body is no longer the same and you're not able to kind of do the same things anymore. So I'm certain that plays a role in grieving parts of yourself that maybe you didn't realize that you would be grieving. Like, here's this amazing celebration of, you were on disability for 6 years and now you get to go back to work, which is amazing and so exciting and brings a lot of joy. But there's also a sense of grief that comes with that. So maybe you can speak to some of the grief or guilt or things that you have had to adjust as you've gone back to nursing after being gone for so long.
Of course. I didn't know what to expect, but a part of me knew that it was the right time. Don't ask me how. I felt, okay, this is the best I've felt, dealing with chronic illness, and I think this is the right time. I didn't know what to expect. Oh, I sure didn't know what to expect. Yeah, it's definitely been eye-opening, and nursing has definitely changed, and I know COVID played a huge role in that, and I was out during that time, so I didn't get to experience that. And so I left pre-COVID, came back post-COVID, and you can only imagine if everything among us, around us changed, nursing had to change as well.
Oh, yeah.
So it's just a lot more autonomy, a lot more responsibility. A lot more responsibility. Did I say that?
It seems like there's, from the conversations that we've had at least, that there's a lot more expected of nurses in general coming back post-COVID versus when you were there pre-COVID.
Oh, definitely. Things change. And it's also what makes it a little tricky because I didn't go through that.
Yeah.
And so I'm coming into the nursing field after being away during one of the most crucial times in the world. And so what I knew as nursing, now it didn't change completely, but it changed a lot. And so in my head, I'm like, okay, we do things like this. Okay, we don't. Not anymore. Okay. All right.
So there's been a lot of like, it sounds like catching up, maybe.
Oh, big time. Catching up. There's new procedures they're doing that they weren't doing years ago.
Yeah.
So it's also very fascinating. Learning new things.
Sure.
It's pretty neat.
That's awesome.
Yeah. And, it's a lot of grieving because it's very physical. It's more physically demanding than I thought it would be. And that's the
Then you remember it being...
Yeah. So it's kind of like...
You're going in with a different body.
Exactly. That body that could handle the physical work with, minimal pain was gone.
Yeah.
And, we were just talking. My shoulders were burning last night.
Yeah.
Once my body cools down, it feels everything throughout the day.
Yeah.
And so it doesn't feel great because a lot of times I struggle and I find myself mentally being pretty awake and with it, but my body's kind of like sluggish. It's dragging its feet. So my mind and physical state don't necessarily match up. So it's definitely a lot to process, a lot to grieve because I'm not who I was.
Yeah.
And so at times I do find myself like, oh, I used to be able to do that really fast.
Yeah.
And okay, well, it looks different now. I can still do it, but it's different. So it's a lot of acceptance. It's a lot of changing my perspective. There are things that I can't do physically as well, but there are things I understand more now.
That part.
I can now advocate better for my patient because I've been in the trenches. I've lost track of how many surgeries, and well, I work at an outpatient surgery center.
Kind of helpful.
So it really comes in handy, and just being able to be there with a patient who's anxious because this is their very first procedure.
Yeah.
And, being able to care for that person, it's this satisfaction. It's this sense of purpose.
Yeah.
It's a privilege that I'm really glad that I get to experience again when I thought I wouldn't.
I love that. What do you feel like you understand now about care that maybe you didn't understand before?
I didn't understand advocacy as much as I do now. I didn't realize how hard I would have to advocate. I thought it'd be easy, but it wasn't. And that was eye-opening.
Yeah.
I mean, whoa. And so now I'm much better at advocating. I'm better at not taking no for an answer. And I'm better able to stand up for that patient when they're so sleepy and aren't feeling it yet.
Yeah.
And I'm like, well, nope, patient's not ready. Not ready. So I'm able to be more aware of those things.
Sure. Because of your own experiences.
Yes.
Yeah.
And I'm also I really strive to include the patient in their care.
Yeah.
Before, I didn't understand the concept of we know our body best. And I'm not going to name names, but there are healthcare professionals who still don't understand that concept.
Yeah.
And they think as the healthcare professional, they know best because they've gotten the schooling.
Oh, yeah.
But it's not their body that they're treating. It is another human who is attuned to their body, who can tell you exactly what they themselves are feeling and what that feels like for them, to them.
As a person who is very attuned to her body, I can attest that this is true. Very, very true.
This is a point that I drive home.
Yeah.
I use this every single day at work.
Yeah.
A patient, it doesn't know what to do. Should I go home? Should I stay? And my question to them is, how does your body feel right now?
Yeah. Yeah.
Can you explain to me what you're feeling?
Mm-hmm.
And more often than not, the patient having that opportunity to express what they're feeling,
Mm-hmm.
I don't need to give them an answer because
No,
they
because they'll
actually
figure
know
it
the
out.
answer.
Yeah. You're empowering your patients to make better decisions. Not only are you advocating for them on their behalf, but you're also empowering them to make the best decisions they can for themselves. And I think that that's beautiful. If you could speak to other nurses, other healthcare professionals who may be listening, this question's kind of twofold. One is, what would you want to say to them as a provider who is living with chronic illness, who's going through a major medical diagnosis, who maybe isn't able to show up in the ways that they were prior to diagnosis? From the things that you have learned, what is a piece of encouragement that you would have liked to hear maybe when you were in the thick of it, before you were able to really get back into it, or even now as a nurse back in a setting being chronically ill? What are some maybe words of encouragement that somebody could take with them?
Yeah. You know, I feel that when I first got diagnosed, it was lonely. It was so scary because even though I'm a nurse, it was hard to go there. I knew what was coming, but I didn't want to face it. I wasn't ready to face it.
Yeah.
And knowing what's coming is also, good, but also not good. Because then you can easily start going down that rabbit hole. And so what I, as a healthcare professional in the patient bed, would love for healthcare providers to know is that take a moment to be emotionally available for your patient. Because more often than not, the patient is emotionally trying to process what that patient's being told.
Yeah.
And the brain, things don't necessarily click because you're so distraught. So don't hold that against me. I may be a nurse, but right now I'm going through it.
Yeah.
And I just need someone to tell me this sucks, but you'll get through it.
Yeah. Yeah.
So being emotionally available and just being encouraging, not going in and looking at me like a task. Because there were nurses that looked at me as, a girl missing a colon.
Yeah.
But I'm also a girl. I'm not just missing a colon. That's not my entire identity.
Yeah. Yeah.
And, I wish that some of them really understood what that meant for me. But it's hard because that nurse didn't have her colon removed.
Yeah.
But the empathy goes a long way. And even if you can't put yourself in those shoes, but just taking a moment to change your tone, use kind words, not be so task-driven.
Yeah.
Because sometimes those small moments where the nurse says, I know it's bad. Mean more than, oh, I got your IV in the first try. Like, great, thank you. Thank you. But thank you so much more for taking the time to sit there and talk to me.
Yeah.
Because at that time, that's all I needed.
Yeah, absolutely. I think that is like the epitome of compassionate care. And I think that when you're dealing with these major medical diagnoses and your life is changing, I think that's what every patient needs, is that compassionate care and like just being seen as a person and not as their diagnosis.
Yeah. And it's pretty cool when, let's say, a patient will be, oh, I just got a hot flash. Oh, these are hot flashes from hell. And I can say, oh, you get them too.
Yes.
You get them too. And then it becomes this Me Too moment with the patient. And it's interesting when patients are like, you too? It's almost surprising. The tone is surprising. You too? And it's
Yeah.
like, yeah, like, nurses get sick too.
Yeah. Yeah. I love that. It's like
So it's,
it sounds to me like you're learning how to hold those two identities at the same time. You've learned and you're learning how to actively hold the role of patient and nurse. And I think not only is that making you a better patient who loves herself, but you're also becoming an even better nurse than you were 6 years ago. And I think that's beautiful.
I'm really trying. I
Yeah.
really am.
Yeah. I love that. What do you hope that listeners who are patients or caregivers or clinicians take away from this conversation?
Ooh, that's a heavy question.
I know.
Where do I
Sum it all
begin?
sum it all up in one answer. You got this.
As a patient, advocate. Don't take no for an answer. As
Yes.
a nurse patient, you let them know you're not in the best place. It's okay to speak up. You're not going to hurt the nurse's feelings. But oftentimes, nurses are so caught up that they may not be aware. They might miss, a change in tone or facial expressions. So don't be afraid to tell your nurse what you need.
Yeah.
I feel like that's one of the biggest things that, being back in the field, oftentimes patients don't speak up.
Yeah.
And then when you start asking, questions here and there, then they're like, oh, actually, you know what? Could I get, you know what? Yep, I hadn't even thought of that. Or maybe they did and they didn't know. I've
Yeah.
also been met with, oh, I didn't know that was a possibility.
Yeah.
Oh, I didn't know I could do that.
Yeah.
And so express your needs, and it's easier said than done. But if there's something that you feel you need, say it.
Yeah.
Because it may be something that you can get, or it may be an option for you. But if you never say anything, then you may never know. As healthcare professionals, empathy. Empathy, please, empathy.
Yes.
There are healthcare providers who are fantastic and have this nailed, and it's beautiful to see. Surgeons treating their patients as a person, as a human, involving them in the decision making. It's beautiful to see.
Yeah.
And so for those healthcare providers who are attuned to their patients' needs, keep going, because it means the world. It means more than the medications, more than the IV start. It's what matters the most. Being treated as part of the team, not someone who's, being operated on. No, I am being operated on, but I also help the team get to the decision that we made together as a collective.
Yeah. Absolutely.
Gosh, I could keep going, but I think we're way past our time.
It's all good. It's all good. I feel like, sitting with all of this, I keep thinking about how much of your story really lives in the gray areas. It's not so much before illness, not after illness, but really in the middle of becoming something new.
You don't just stop being a nurse because you're sick, and you don't stop being a human just because you're trained to take care of others.
Yeah, absolutely. I think that's what stays with me the most. The way that you've learned to hold both without forcing yourself to just be in one of those boxes.
And it took a good amount of time, and still learning. And a lot of unlearning had to take place, especially the idea that needing care somehow means that you've failed at being strong or even capable.
Yeah, absolutely. I'm so grateful that you have shared your story and trusted this space and our listeners with all of this. I think these are the kinds of stories that don't get told often enough, but they really truly change not only how people see themselves, but for so many of us who are living in the chronic illness space or with cancer, it changes, I think, how we interact with our nurses and how we show up in that space.
Yes, and if you're listening and any part of this resonated or felt familiar, whether you're a caregiver, a patient, or somewhere in the middle, I hope that you heard there's no wrong way to exist in this space.
Absolutely. Please remember that there's room for your grief, and there's room for rest, and there is room for letting yourself be held.
Always. Thanks for joining us on More Than a Diagnosis. We hope today's conversation left you feeling seen, heard, and maybe even a little more connected.
If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who might need it.
And if you're looking for a place to connect with others who truly get it, join our support circle at morethanadiagnosis.org, where we will continue this conversation. It's free, it's welcoming, and it's built for you.
Because no one should have to navigate this alone.
Until next time,
keep living, keep growing, and remember,
you are more than a diagnosis.